Hi everybody, I'm struggling through life, so I choose to make this video which has the required audio for this project, and my focus is on slide 56, respiratory assessment. For my project I watched the videos, the PowerPoint or whatever that was. I watched the Spices video, and I'm also using one of my favorite books, Nursing Wellness in Older Adults by Miller Tabers, which I have this with me at all times when I'm at work. It's such a great resource for nursing care and just trying to figure out what's going on, assessments, and also the Bates Nursing Guide that was required from this class. So my focus is, I'm going to share a story with you first. Yesterday at my new job, we had a woman who, she's in bed all the time. She's got like a mechanical soft diet. She eats in bed, she lays in bed. I don't know the last time she coughed and deep breathed. This is like a new job and I'm orientating there. It's understaffed. There's a lot of patients, and I don't just think that this woman is, she may be getting good care, but I don't know if she's getting the right care. But yesterday she became kind of sick, did a whole respiratory assessment on her, and she's got some diminished lungs, some crackles up here. So she's we got an order for a CXR, and to see what's going on with her. But I think one of the biggest problems in nursing homes is that people aren't watching the lungs, watching what's going on with lungs. I think that these patients are just laying around, and so according to the Spices video, the first three are those are Maslow. Those are Maslow's most needs from a person. People need sleep, people need to eat, and people need to urinate. So I thought that was interesting. And the other one, the other three, confusion, falls, and skin breakdown, this is something that we are always, I know when I'm giving report or getting report, I'm always curious. I'm really always using this tool, even though I didn't know it was a Spices tool from Fulmer. I'm always using this. I want to know, when I come in the morning at 7, I want to know, did that person sleep? Are they eating? What about their incontinence? Have they gone, off their baseline mentally? And falls are always reported, of course, in report. And I always want to know the patients that aren't moving around. I want to know what's going on with their skin. And at my job, my regular job, not the one that I just quit, we have regular skin checks, so we stay on top of things. But in terms of aspiration or assessing older adults, of course we're going to do the vitals, lung sounds, O2, and respiratory assessments, and also, what are they eating and how are they eating? What's their diet? Like, why are they having if they're having lung issues, why are they having their lung issues? And of course, this is a good time that we can identify opportunities for health promotion, whether it's they're smoking or if they're choosing to eat in bed instead of getting out of bed and sitting in a chair and sitting upright so that they can avoid any type of aspirations, or just coughing and deep breathing every couple of hours, if because I know a lot of them, 10 times an hour is just too much. So any opportunity to try to promote their health is a great way to end your assessment. And also, older adults don't present the same when they have pneumonia. Like, usually people with pneumonia will have the cough, the chills, the increased temp, the increased white blood cells, and even a CXR might come back negative. But with older adults, they're going to have altered mental status, which is one of the Spices. Incontinence, another Spice. Unexplained falls, another Spice. Sudden agitation, and a failure to thrive. So that's how that all ties in together. And I think that the Spices, now that I know that the Spices is a tool to use, I will be more conscious of it in my practice. Thank you for listening.